Well, good afternoon, everyone. As you know, I'm Janice Whitaker, and it's my pleasure and privilege to serve as the administrator for the Teresa Neese and Helen Diskovich Center of Geriatric Nursing Excellence at the Ross and Carol Neese College of Nursing. And it's my privilege to serve as the host of the CGNE seminar series. Exciting to have a hybrid format today. So we have some in-person participants. Welcome, Matt. Nice to see you, as well as everyone else that's here at UP. And I know we have some virtual participants as well. So welcome to everyone. This program is being provided by our center, along with the Center for Nursing Research, Outreach and Professional Development here at our college, as well as Age-Friendly Care PA. Today's seminar is entitled Intergenerational University Connections Program in Pennsylvania, State Government and Universities Collaborating on What Matters. And it will be presented by our colleague and friend, Stephanie Cole, Special Assistant to the Secretary at the PA Department of Aging. But before the presentation begins, we do have some disclosures and announcements. So the Penn State Ross and Carol Neese College of Nursing is approved with distinction as a provider of nursing continual professional development by the Pennsylvania State Nurses Association, an accredited approver by the American Nurses Credentialing Centers Commission and accreditation. Participants with a valid RN license who attend the entire nursing continuing professional development program can earn 1 contact hour. Partial hours are not awarded. The topic of this education is non-clinical, and therefore we did not identify, mitigate, or disclose relevant financial relationships. In order to earn contact hours, Zoom in and out times will be recorded. And for those of you that are here in person, please make sure you sign the sign-in sheet outside the door. And everyone is required to do a post-evaluation survey. Those that are joining us virtually, there will be a link put into the chat for you to copy and paste. For those of you that are here in person, we have paper copies thanks to Jenny's efficiency. And people also will get it via email within a day so that you can do it after if you choose. But they do need to be completed within a week of the seminar. And then if you do earn those contact hours, RNs will receive a certificate within a month. If you have questions, you can put them into the chat today. If you're joining us virtually, Jenny will monitor that. If you're here in person, of course, you can share your comments and questions aloud. And those of you that are joining virtually also can raise your hand to be unmuted, and you can share comments and questions aloud as well. So I think we're good with that. I'd also like to recognize another special guest that we have today, Denise Getkin, Director of Protective Services, who is with us today. Both Denise and Stephanie are visiting our center and college today to work on collaborative projects, share important updates with each other, and hopefully identify some new opportunities to collaborate. And we really appreciate our partnership with the PDA. So next, I'd like to introduce Amy Cristantello, a DNP graduate student that has a geriatric focus. And Amy is an affiliate with our center. We're super thankful to have her today to introduce our speaker.
Thank you, Janice. I'd like to introduce Stephanie Cole. She is the special assistant to the Secretary and Director of Special Projects at the Pennsylvania Department of Aging and a 2022 recipient of the Governor's Award for Excellence. Stephanie spent the first part of her career in leadership positions in private sector corporations before opting for a mid-career shift to the field of aging at the Pennsylvania Department of Aging. There, she has held roles in quality assurance and supervised the department's data collection efforts. Currently working directly for the Secretary of Aging, some of her major accomplishments have included championing the department's 4-year federally required state plan on aging, leading the department's outreach and inclusion efforts with LGBTQ older adult communities, and developing collaboration with universities across Pennsylvania that have initiated ongoing intergenerational service learning programs. These programs partnered students with older adults in semester-long virtual engagements that address the educational goals of faculty and bring purpose to the lives of the older participants. Stephanie has a bachelor's degree in psychology from Shippensburg University and a master's degree in community psychology and social change from the Penn State University.
Okay, great. Thank you, Amy. There we go, that's it. Okay, great. So, well, first I wanted to say thank you, Amy, for the introduction. Thank you, Janice, and thank you to the CGNE for having me here today. And just wanted to say thanks on behalf of the Secretary of Aging, Robert Torres, and also on behalf of my colleague Denise, who's here with me today. We just really appreciate this relationship with the CGNE, and just feel like this has been extremely fruitful for as long as we've been connected with you, and it just seems like time has really flown by. But again, I'm excited to be here and excited to share with you about this program. I'm going to take a couple minutes to talk to you a little bit about our role at the department, sort of how we see ourselves fitting into state government, and then take that into the population of older adults in Pennsylvania and how that translated into an intergenerational program, which the Ross and Carol Meese College of Nursing is participating in. And I see Dr. Sierra Funk in the room today. Her class is participating in the program. So with no further ado, let me move on to the first slide. So the role we have with serving older adults is, I would say, since we're a small government agency, we have about 100 employees, and I think it's important for you to know that, because in the grand scheme of things in state government, there's about 65 to 70,000 state employees at any given time. We have 100 at the Department of Aging. Department of Human Services has 15 or 16,000. Department of Health has 12,000. So 100 tells you, our reach only goes so far. We oversee Older Americans Act programs, and we are about 82% funded by the Pennsylvania Lottery and 18% funded by federal funds that come our way. So we try to fulfill a lot of our role through these avenues that I'm going to talk to you about for a second right now. First of all, we provide oversight over the Older Americans Act programs that we administer through our 52 area agencies on aging across Pennsylvania. We want to ensure access to services for older Pennsylvanians, and that's folks 60 and older, and equity of services. And we were just talking to Liza, who's in the room right now, about this earlier, that we want to make sure that we're outreaching to folks. So we're not just serving the folks that find our area agencies on aging, but we are outreaching to people who are underserved and don't know where we're at. We want to make sure that we're expanding our reach to people by creating strategic partnerships like the one we have with the CGNE. We want to do capacity building. So capacity building by creating relationships that allow us to serve more people in strategic ways. And then finally, but I would say the most important, and my colleague Denise is here, she's the director of this program, is to protect older adults. And we have a expansive older adult protective services program. So that broadly is what we do at the Department of Aging. And our population in Pennsylvania, as you probably all know, is growing. The older adult population is getting older. So by 2030, nearly 1 in 4, or 4 million people, Pennsylvanians will be 60 or older. And just a couple little snippets for you. Right now, 31% of older adults, 65 and older, are living with a disability. Now this one's interesting, the poverty numbers for folks 65 and older in Pennsylvania. The poverty rates range from 6.8% to 39.7%. And the reason why I put those numbers in there is that the 6.8% represent folks that are white, and it goes up to 39% based on race. So I think that's very important for us to note. 683,000 older Pennsylvanians are householders living alone. And I also wanted to point out that between 2010 and 2040, the 85 plus population, which in 2010 was about 335,000 people, is expected to double to over 600,000. And obviously, we all know those are the folks that are likely to need the most care. So what are the challenges of this growing and diversifying older population? We, of course, at the department, we recognize we need to support family caregivers as part of an informal, but also a critical system of care, because we're not going to have all the people that we need to take care of every older adult. And then we talk about this every day at our office, fighting ageism and valuing the contributions of older adults as important in our world. And the workforce issues impacting other industries are also impacting older adult serving systems of care. So I think we've talked about that even this morning, that attracting folks to our industry, young adults and others who we want them in our industry, and know that once they get exposed to it, they tend to gravitate to it. How do we get them that exposure? So college students, direct care workforce, and then fighting the growing exploitation of older adults through more and more complex scams that are out there, and financial exploitation has really blown up over the last several years. And then protection for older adults while preserving self-determination and person-centeredness. We're seeing a lot of this in our protective services programs, where there's a delicate balance between allowing individuals to remain independent and having them tell us, this is how I want to live, but knowing that it may not be the safest situation for them. So we're working through all of those difficulties. And then fighting depths of despair, like social isolation and loneliness, and that's where this program comes in. So what is social isolation? By definition, it's an objective lack of connection or contact with others, versus loneliness is a subjective feeling of being isolated. And so this is going to kind of lead into the discussion about the development of the program and what it's done and where it's headed. So the United Health Foundation, and many of you may know about this, they put out an America's Health Rankings report every year. And I find this to be a very useful report myself. And I was just looking at the 2022 Health Rankings report on social isolation. So that report tells us that 24% of individuals 65 plus considered socially isolated based on risk factors, and I'll talk about those in a second. And 43% of those 60 and older report feeling lonely. 35% of people 45 and older report feeling lonely. And so why is that important, or how can those factors play into prevention? Because I think, you know, I'm here talking at the College of Nursing, and we're all concerned about prevention. We don't want to, if there's anything we can do to prevent folks from having to need medical services, it would be great to head those things off at the pass, right? So research tells us that social isolation and loneliness are associated with the following. So in this little chart, I kind of hit it from both directions and met in the middle. So both are associated with increased mortality, increased risk of functional decline, increased risk of dementia, higher rates of depression, anxiety, suicidal ideation, longer hospital stays, and increased cancer mortality. So as you can see, problems. So how do we address that as a group? This slide, so what people might be more susceptible to social isolation. So folks that, these are factors that influence it. If individuals' immigration status, that could influence the race and ethnicity, level of English proficiency, and their sexual orientation and gender identity status. Those are all things that can impact someone being isolated. And coincidentally, the Older Americans Act, which I mentioned earlier, are the programs that we oversee at the department. Those are also factors that we as a department, we consider those target factors for our programs in terms of what individuals are considered greatest social need. So greatest social need meaning those individuals may be isolated because of cultural circumstances. And then what are some other risk factors that may impact anyone? And I can read them for you. Those who are in poverty, individuals who are living alone, individuals with a marital status, I'll say other than married. So anything other than married, if you've never been married, divorced, widowed, separated. Individuals living with a disability, and individuals with one or more ADL difficulty. So I'm going to give you a little snapshot of what that looks like in Pennsylvania. So I said we have 52 area agencies on aging in Pennsylvania, and there's 3.4 million people over 60 in PA. Our area agencies on aging, a snapshot at any given time. In June, we looked at this, there were about 580,000 active folks in that database system. And we took a look at those factors in our system, and we found that of the people we talked to from our area agencies on aging, over 7,000 people had all 5 of those risk factors: in poverty, lives alone, the marital status, living with a disability. And that actually is just a tiny decrease from the last time we had looked at it about 6 months earlier. But that, to have all 5 of those risk factors, that is a lot going on for one person. And I would generally say that person may not be getting out very much out of their house. But 4 out of 5 risk factors, there's over 42,000 people, and that's just in our database system. So we're only talking about a chunk of the older adult population that we see. And that has been a slight increase over our previous look. And then I took a look at 3 of 5, 91,000. Even 3 of 5 risk factors, again, a lot going on for one person. Looking at geographically, many of you probably already know Allegheny County has the highest population of older adults in Pennsylvania county-wise. They also have the most clients in their database system with 5 out of 5 risk factors. Philadelphia has the most with 4 out of 5. So in terms of outreach to get services to folks and impact them locally in the community, just a little bit of what you're looking at there. And certainly you're welcome to interrupt me if you have questions. We can hold off till the end, but if you have a burning question, please just raise your hand. That's okay. So just a little bit about the impact of intergenerational programs. This is just a little bit of the research out there, and I know that there's one person here in the audience who will not argue with any of this and who's very supportive of it and would say that intergenerational problems can solve any social problem. Intergenerational programs can solve any social problem that you have, and that's Dr. Cadwin. So I'll just go through these intergenerational programs, social vehicles that foster engagement between younger and older generations by offering opportunities to interact in mutually beneficial planned activities in which there's a sharing of knowledge, skills, and experience. So they're activities that support older adults' engagement, sense of purpose, usefulness, and positive affect, and support young adults' perception of older adults that use technology in various ways, and then reduce anxiety and improve cross-age attitudes. The one thing I want to highlight here is the whole sense of purpose thing. That's having a sense of purpose is something that at our department that is part of our mission, is to create a sense of purpose for older adults. And while this intergenerational program, we initially targeted individuals with risk factors for social isolation. We mainly meant it to be a purpose-building engagement for the older adult, and we presented it to the older adult as this is a volunteer opportunity for you, not you, oh, we see that you may be isolated, so come on, let us help you. It's hey, we think some college students could benefit from your experiences, your life experiences, and would you be interested in this opportunity? So just to kind of clarify that. So this slide talks a little bit about the launch of the program, but I'll give you a little bit of the background. So the program started in 2020 and sort of was born out of, it was the onset of the pandemic and the closure of Pennsylvania's over 500 senior centers that are affiliated with our 52 AAAs. So we had 500 senior centers, most of which provide congregate meals daily. Many of the older adults that attend, they attend for the congregate meal, but they do attend for socialization, and that was the design of senior centers, was to promote socialization too. When we knew that this was going to happen, the fact that older adults were going to lose out on this opportunity to connect with their friends was something that was a major concern for the department. We knew that many of the senior centers were building sort of contingency plans with their staff on how they would build out contact plans for their regular attendees, but we knew that that wasn't necessarily going to completely cut it. We were meals wise, that was, although logistically that all had to be worked out, we turned to grab and go meals and meal deliveries for those attendees to ensure they receive that balanced meal every day. I think the nature of trying to ensure that there was that social connectedness part met for older adults was something that was a little less defined and couldn't be met by, you know, sort of just developing and executing a plan like we did for the meals. So that was a worry right away. And when the idea came to us at the department to begin this program, it was sort of, the colleges are sending students home. These opportunities for students to engage out in the public with older adults in facilities or in senior centers, places where they might get experiential learning, are going to be taken away. How can we match these two needs to benefit each other? So we as a department reached out to the state system of higher education just because for us it made the most sense because of the contracting and things involved. And the state system of higher education liked the idea and kind of just sent it out to the various universities throughout the state that are part of that state system. And we just sort of waited for a response, and a couple of universities were very interested, and we settled in with one for the first semester, which was the fall of 2020. And there were two faculty members one was in behavioral sciences and one was in recreational therapy. And the students ranged from second year to fourth year undergraduates. Older adult participants were from two different area agency on aging planning and service areas in the local area. So just for your reference, it was Slippery Rock University and Mercer and Butler counties. Interactions were by telephone for the older adults, and they were weekly. And they were, and I'll just explain that, you know, it was sort of a, yes, we're going to meet these older adults where they are. If it's an older adult in poverty in general, they are going to have just a telephone. Many students don't weren't connecting with that at first. You mean they don't have this? No, probably not. They're gonna have one that's maybe even tethered to a wall. So that's how it started. But and I'll talk about this in a few minutes in more detail, but to me, the value of the two initial faculty members that I was connected to for the program was that we were all somewhat comfortable with the ambiguity of this is a pilot. We don't know exactly sure we're not exactly sure what's going to happen, but we will work from this first semester and see what we can do. But right now we're in a pandemic. The students have no opportunities to connect out in the community, and this is one way to be able to do it, and it's serving a dual purpose, and we were all very flexible to do that. So I think that's important to note when we think about these types of connections and initiating programs of this kind, that you have to be open that it's not going to be perfect and meet people where they are, at least at first. Let's see here. I will just note too that the faculty members, both faculty members had varying expectations for their students. The first and second year behavioral sciences, I believe it was a Gero psych class. They had weekly reflections that they had to do. The recreational therapy students had to do leisure preferences surveys with the older adult and activities over the phone. So it ran the gamut as far as intensity of what they had to attempt to try to do over the phone. So one of the things that we provided as a department to the faculty members so that they could share with their students if they wanted to have them work on some kind of assessment product is we use the Love and Social Network Scale and the UCLA Loneliness Survey as pre and post assessments for students to use if the faculty member didn't have something specific they wanted to have the students do. And from those findings, older adults, we found 29% of those surveyed reported lower feelings of isolation from others than at the start of the program. 16% reported lower feelings of a lack of companionship than at the start of the program. 2 reported greater feelings of isolation or lack of companionship in terms of their social network. In terms of their social networks. Let's see here. Some reported the desire for more interaction with others when social networks were minimal. Some verbally expressed feelings of satisfaction, life satisfaction when social networks were more extensive. And this I thought was interesting. Those with smaller networks who had hobbies or pets expressed happiness about the impact of those things on their lives. The one other small thing I thought I would point out too, and I think one of these bullets is tied to that the first semester was the fall, and because of the way the semester ends sort of right at the holidays and those relationships were kind of cutting off, I think some of those post assessments were reflective of the kind of grief of, my student we have to end this now. Yeah, so I think that was hard for some of the older adults, and questions did arise. Well, we are friends and we are enjoying this, so can we maintain this friendship? And that came back to us as an ask at the Department of Aging, and we discussed it with the university, and we discussed it with our legal counsel, and there was nothing in our MOU that precluded students from maintaining a relationship. They were adults, the older adults are adults, and we said, once the semester ends, that's up to you. If you want to be on the phone with each other and be pals, that's great. And I think a lot of those relationships still exist. Let's see here, some reflections from students. So real life application of what was learned in class. So this is a quote from a student. I was able to use what I've learned in my classes in a real life situation. I haven't had much experience with clients because of COVID, so this was a new experience for me. Better understanding of older adults. I have never worked with older adults before, so I was I wasn't completely sure what I was doing at first. This experience showed me that I enjoy working with the older adult population and that I would like to continue to do so after this program. And then on finding commonalities. This also was an enjoyable learning experience for me. I was able to learn a lot from person A, especially since we had a lot of things in common. He taught me a variety of things that I did not know about, which I appreciate. Off the cuff, I can tell you there were students that say that they received life lessons from their partnered older adults that they weren't receiving outside of this situation. So, you know, I've shared information about this program with a lot of people who are ending up becoming involved. So other smaller stakeholder groups, partners within my own agency at the Department of Aging. And I almost feel like the students are getting maybe more out of the program than the older adults at this point. We've had students say it's the best project that they had their entire 4 years in college. And I'll just say, I don't know if that's somewhat a function of families, you know, separating and making their way to their careers wherever that finds them in the world or country. But people maybe are not as close to their nuclear family, grandparents and things like that. But I think students have really gained from this experience. And then another thing, this current semester, we had our oldest participating older adult was 102. So to have perhaps a 20, 21-year-old partnered with somebody, you know, removed from them by, you know, 80 years, to share the experiences and learn from them is pretty amazing. Another just small anecdote about older adults and what it has meant to them. We've had workers, older adults with workers, tell us when they have had, this is a worker that their older adult was having virtual meetings with a student, and they said, yeah, he wanted to be dressed up for his meetings, like he wanted to be helped into a shirt and tie to meet with his student because he wanted to look good. And then I could go on and on about when the older adult and student are just completely different, racial diversity mixes, and what the learning is there. It's really just amazing. So there's successes and challenges with this program, and I'll review my list, and I was hoping that Dr. Funk maybe could share some thoughts too. Some successes, what worked well. So it helped on our side in state government. We have a very supportive administration and supportive Office of Aging. On the academic side, administrators and faculty who recognize the value of these partnerships and are willing to work within a somewhat ambiguous situation. $0 spent on the program outside of administrative time. I mean, who wouldn't like that? And allowing for a slow organic growth on both sides. So the client side never got too large too fast, and neither did the growth on the university side. Trying to listen and adapt the program based on feedback from all involved. And then having the program as a service learning option that allows the students and older adults to stay distant and safe, even though it's all virtual and you would think that's impersonal. It's been okay. I think everybody's still been fine with it, and nobody's putting anybody at risk or making anybody feel worried about being at risk. So that's been a win. And then some faculty members have mentioned, you know, we're moving to more of a telehealth environment, and this has been helpful for students to learn about that. Some of the challenges, past and current, initial contact between the student and older adult may be problematic or may not occur. Sometimes, well, we tell older adults, don't answer the phone if you don't know the number. So sometimes those connections don't get made initially. sometimes it's hard for us to get enough older adults. Or juggling, okay, I have 500 students from across Pennsylvania. How do I get enough on both sides to manage it? And then helping the older adults understand what the program is. I'm counting on people outside of the Department of Aging, so area agencies on aging and other stakeholder groups and folks who work around me to basically sell the program, if you will. But it requires some finesse to really engage an older adult. And I think some older adults maybe think, well, I don't have anything to give. Because we tell them that as a society, we tell them they don't. So we have to tell them, yes, you do. The student can learn a lot from your experiences. So we're trying to overcome all those things. But I'm really happy to have Dr. Funk here. And I think she was going to share a couple things because she had initially 70 something students. Not all of them ended up staying with an older adult, but some did. So
Can I talk from here? Can everyone
Please,
hear me?
yeah,
Okay.
the microphone's
Oh.
right there, so you're, so
Oh,
you're good.
awesome. Okay. Hello, everyone. So I teach at the UP campus here at Penn State, and I teach nursing 310 care of the older adult, which is in the junior level. So I had 68 students start out in this program initially, and we did do it where they would talk to an older adult for 10 weeks, 30 minutes a week. So at this point, I had 68 students start, and now I have 29 students that are still participating in the program. So this will be their last week. So they'll be finishing up, so I'll have more data. So that's roughly about 43% of the class that's still participating. So there were many positives that I'm noticing. Many students have voiced their love of the project and their bond with the older adult. For many participants, they have started to look forward to their calls from the student, and vice versa. The student looks forward to talking to their participant every week. I feel this project does teach the student regarding effective communication and also combating social isolation, and also how to conduct a life review. For the weekly questions, I gave them a Q bank of questions they can ask the person about periods of their life. But if they just wanted to get on and talk about whatever was bothering them, or whatever they have going on, they could do that. They didn't have to answer the questions. The students also practice continuity of care outside of the healthcare facility, which is huge because I'm trying to move the clinical from in just talking about what happens in a facility to like outside of the facility, and social isolation is a big issue. So it also creates empathy from the student to their participants. The students also have become advocates for their participants as well. We've had instances of that. They're able to use this as clinical hours and also as a service opportunity. Barriers, and I do see this as like a PDSA type of continuing education, of a continuing quality improvement effort. So some were not able to get a hold of their participant for various reasons. Some, despite being screened by their regional case manager, did not want to be involved after they said they did in the beginning for various reasons. Many had declines in physical status, or like, so they had to have like treatments or surgeries and they couldn't do it any longer. I am having to do a lot more like upfront work with this semester, but now that I'm seeing what's working and what's not, I can continue to work with Stephanie and Denise and with my CGNE crew and get things better. Also, I'm unable to ensure the integrity of students throughout the implementation of this project. So basically, I'm laying the law down, saying this is a requirement, and then I'm checking in with your older adult, and I'm checking in with the case managers. Even if I'm not really able to do that, just them thinking that has kind of kept them on the right path, and that they'll fail clinicals as a requirement, right? So many participants were not able to meet on a weekly basis due to like bad family gatherings, outside commitments. And then we tried to implement iPads to be used through Tech Owl, through Temple University. And most of our participants were afraid of that. They did not want to have that delivered to them. They were afraid they wouldn't know how to use it correctly. So it was just, they didn't get to see their students face to face. Some of them have cell phones, yes, but. So those are some things that we will work on, but the students have enjoyed, the students that are still doing it are really enjoying it.
So how are they recruited? Are they recruited through the PA Department of Aging? Or are they like, I wasn't sure if they were like the people that they're already caring for at Center Crest, right? Or like another
No.
clinical site. So they could be across the state of
Yes, in
Pennsylvania.
different
Yes.
counties, yes, none of them are in Center County, they're all out in like Allegheny, out in other counties.
So
Okay.
we have we have area agencies on aging who agree to participate in the program. Then we provide them with sort of, I'll say lead lists of people with social isolation risk factors, either 3, 4, or 5 risk factors. But we also say your care managers may know best. They may have a client that they know this person would be great. This program suits them. And we ask them to, create these lists of clients, but they have to outreach to them. The person has to agree to do it. And then the way that I assign them to the universities is I try to be mindful of, since like Dr. Funk may need to reach out to the area agency on aging or a care manager, a student may need to reach out to a care manager. I try to not overwhelm one university or one faculty member with a bunch of area agencies on aging. So if Allegheny County sent me 70 people and that could fulfill Dr. Funk's needs, I would say, boom, that's, and the other thing I found with, for example, when Slippery Rock was the only university participating and all of the clients were in Butler and Mercer counties, a couple of students knew the older adults, so that wasn't a great thing either. So it was better to keep a little more anonymity by.
So I know you talked to the older adults to measure some things. Were there any sort of, I would be really curious what the ageism, if there's an ageism scale that could be assessed of the college age students to see if that
That's a great
changes over
idea.
the course of time or.
That's a great idea. So
Yeah.
the faculty member at Widener University who's participating in the program, her students have to do a paper. They're intro to social work students, and they do a term paper on this program, their participation in this program, and they do have to reflect on that in that. And there has been a lot of, wow, we had no idea that we had so much in common with people older than us. Yeah. Okay.
So I don't want to take up too
So-
much time.
Yep. Do you have more you wanted to share?
If you had time for the students,
Absolutely,
that's all. I'm saying.
absolutely. We'd love to hear that, Sierra.
Okay, so lastly, I just wanted to, I had a student, I got her permission. This is just one of many stories from this semester. So she's done almost 10 weeks of journaling of her experience, but I took 5 weeks and just kind of pulled a couple things. So I just love my student, and she's taking care of a lady named Judy. So the first week they talked about like her growing up. And then I thought this part was so cute. She says, we took a little break for her to eat lunch. And when I got back on the call, she told me she ate a peanut butter and fluff sandwich. Her favorite food is spaghetti with red sauce and Parmesan cheese and garlic bread. And then she talked about how her dad ate peanut butter sandwiches every day. And then the student said, we talked about it being good protein and healthy fats. So that was week 1. But then in week 2, she was talking about being, as a child, she says, Judy began to tell me about her right leg being cut off. As a child, she had sores on her feet and limited feeling in her right leg. So she had an operation done at age 4. However, her leg continued to get worse, and she had it operated on 3 times. And the last time they made the cast too tight, resulting in loss of circulation, and she ended up having her right leg amputated. She explained how people looked at her different, and she was placed in special education. At home, she loved playing, and then it switches to at home, she loved playing with her doll babies. So like it kind of like goes from one thing, but she talked about her leg in week 3 as well. And she talked about how she was bullied in school because everyone thought she was a cripple. And how she was the only person that went up to a Black kid in her school and played with him on the playground, and all the lessons she's learned in life. And then week 3 is kind of the same thing. where she talks about her hero is her daughter-in-law. She has 3 sons. And at the end of the call, she says, well, that I'm gonna go, but I'm gonna watch my favorite show. It's called My Favorite Martian on TV. So I love how like the seriousness, but the playfulness, it was so cute. And then week 4, she talked about her leg once again, that as a young adult, she loved cleaning for people, but it was hard with her leg being amputated, because that's what she did. And then they talked about pizza, and she said she's definitely a pro pineapple on pizza girl. That was really cute. And then the last entry, she says that she had having young children was her favorite time in life. And that Judy is glad her kids are not in this generation, because she would be scared for them with people taking them or giving them drugs. And she said, we talked about people having put needles in candy and safety pins in apples. It was around Halloween time, I think. She said, lastly, Judy told me about weekend plans, and I told her I was excited to go to the pumpkin patch with my friends. She was happy for me and said, goodbye, honey, love you, which just filled my heart. And this is only through week 5. So, and then this student, of course, is gonna have a relationship with her after this is over. So this is just like one of many of the reason why I want to continue this project. Even, you know, there's some things that need to be tweaked, but over time, I think it will be very good. So that's it.
Well, first I want to thank both Stephanie and Sierra for sharing all this information. We will move into more Q&A and discussion, but I want to pause for a moment and just thank you both. And I know, you know, folks in the room, it's a little easier for you to ask questions and engage in discussion, but I'd like to ask if anyone on Zoom has a question or would like to share a comment. Oops, I guess we do that at the right time, because
I'm just switching the camera back.
okay. Oh, okay, thank you. So Jenny's gonna, is there anything in the chat?
Not yet.
Okay, so Jenny will keep an eye on that, you know, so you can either raise your hand or put something into the chat so that we make sure we're responsive to folks that are joining us via Zoom. But anyone else in the room? Jenny, you.
We did get a question
Oh,
in
okay.
the chat.
Okay.
Teresa Lundy asked, are the participants given the option to participate with another student once the 10 weeks are completed? Or do they continue with the current student if it's agreed upon?
That's a great question. Thank you so much for asking that. They can maintain a relationship outside of the program with their current student if they want to develop a friendship. That's okay. We also offer for the older adult to participate in a future semester, and they would have another student. It would just be, you know, in a class that's participating. So we wouldn't anticipate the student, you know, repeating the same class, hopefully not. But yeah, so we do, if the older adult gets a lot out of the experience and they want to do it again, we hope that they will, and we'll get them involved again, and maybe with a different school or a different major. Yeah.
Stephanie, I have a question for you. You know, I think you talked, and I may have missed this, but I'm pretty confident you talked about an evaluation with the older adults and kind of, can you explain that a little bit more? What does that look like? And then how about the students? Is there some type of evaluation at the end of the program to kind of gain some data and be able to analyze what their experience was like?
So most of what we've done with the older adults has been just sort of gathering what we hear from the students and what we find out from their care managers about what their experiences were. And if either of those, the UCLA loneliness survey or the LSNS6 were completed, we'll look at that data too. But we haven't done any IRB or anything like that on the older adults to do any formal research. So we haven't done anything like that because we want to keep it more fun and informal for the older adult if possible. So I just haven't looked at doing anything that would jeopardize that on that side of things. The student side, there are a couple faculty at other schools who are doing more formal look, taking a more formal look at the impact of students.
Yeah, Yingling?
Thank you for the fabulous presentation. I was curious if the student get any training prior to the program, and also did they get a structure about what topic to talk about, or any structure?
That's another great question. Thank you for that. So when I talk to a faculty member about participating, I want the faculty member to feel like they can take the program in any direction they want, as long as those contacts with the older adult are made. Most of the faculty members who've sought out participating in the program already kind of get it, so they know they have to cover ageism and all of those topics related to sort of interacting with an older adult and why is it so important. They already know, or they wouldn't have talked to me. But when we first start the program with a class, we offer the opportunity for that class to have a panel discussion with our executive leadership at the Department of Aging. So we've done that with a lot of classrooms where we'll have the Secretary of Aging, myself, and a couple of our directors talk about all of our programs and services and the history of our work, and then sort of a little bit of instruction on what to expect in the program, what might be the things that they could run into, snags and things like that, that might make it difficult to reach the older adult, or what to do if certain things happen. So we do offer, I would say it's a little bit of training background. Yes.
Thank you.
If that answers your question.
Liza?
Thank you for presenting this. This is wonderful work. I'm so excited for you and for the older adults in our communities. And what I keep thinking of here as well, just thinking back that our work is in the nursing home setting, there are several older adults in our communities that are living in these communities that are assisted living, nursing homes that are experiencing at least 4 to 5 of the social isolation risk factors. Is there any thinking of how this program could be adapted to more of a formal setting like that?
So, yes, so next semester, we, one of the colleges that is joining, and I didn't tell you earlier, is Penn State Dickinson School of Law. And we know that 50 of the participating older adults are going to come from nursing facilities. And we are working in cooperation with the state long-term care ombudsman to make that happen. So again, I feel like baby steps in some of those areas, because there's so much coordination with ensuring the older adult has a phone and somebody that can make sure that they're available and everything. So yes, I totally agree with you, and we want to expand in that way, and ensuring the logistics are all there to do that. My colleague Margaret Barajas, the state long-term care ombudsman, she's going to stay very close to this project, as she has throughout, to make sure that we can start including residents who call a long-term care facility home.
And that actually could be a positive about post-pandemic situation, in that so many long-term care facilities did need to implement programming and systems around contacts with loved ones and other people, being able to implement phone calls or use of iPads, so that there was that communication going on. So,
Yeah.
hopefully they have maintained those kinds of systems, and this could kind of, be a supplement to that.
Yeah, for sure.
Sierra, when we were talking about this program earlier today, you talked about, having an awareness that this has helped to enhance or provide an opportunity, at least for students, to build their communication skills.
Yes.
You want to share a little bit about that?
It's just kind of amazing to me when I started teaching this course, how many of our students do not know how to speak to older adults. They feel they have nothing in common with them. They just are like so glued to technology and their phones and all. So this is really, I even had one student, was an international student and her grandparents lived in another country, so she had never really interacted with them before. So this was like her first jump into talking to older adults, and now she feels more comfortable where she was scared to death. So I do a lecture at the start of clinical before they start these projects about ageism and about how to communicate, when to stay quiet, when to listen, how to answer certain types of questions. If there's an issue, how to report that. So we talk about all those things. But this does help with them learning how to communicate, not just with an older adult, but also with participants that may have like maybe some mild dementia or like Alzheimer's or other cognitive impairments because of the disease process. So.
Erica.
So this is beautiful work. And I think, just hopefully some of that will, the breaking down that lack of confidence then translates more to sort of familial situations because there's so much estrangement among families. It's what 48% of American families are estranged in some way. So it's high, it's really high. So that's beautiful.
And it's a confidence booster for the
Yes.
students.
We've had students say they have confidence to talk to people that they've just never had before. Yeah.
And it makes them maybe consider a career in general nursing where they wouldn't have before.
And I think that's one of the
Yeah.
most exciting
Yeah.
parts of
Yeah.
this too, is providing positive opportunities for students to interact with older adults, to potentially give them the idea that maybe they'd like to work in geriatrics. So on that note.
I just
oh,
want a
go ahead.
quick note,
Yeah.
in the
Yeah.
chat, there's a lot of feedback, just, Troy Dunstan says, he wants to thank Dr. Fung, Stephanie and Denise, and just said special kudos, PDA proud. We had, Tana, who, said that her daughter participated in HDFS in 445. They had some similar experiences of older adults dropping out, and they recruited her mother. So her mom has been taking calls as well. And then Amy also asked how would anybody interested get connected, and that would just be reaching out to you, Stephanie.
Sure, yes. So if you could put my email in the chat if you want, stcole@pa.gov.
Well, unfortunately, we only have a couple minutes left, and on behalf of myself, our director, Dr. Donna Fick, our CGNE leadership team, and really everyone at our center and our college, we want to thank you, Stephanie, for this amazing presentation, and to both you and Denise for your collaborative partnership with us. We really value it. So we have just a little something from CGNE for each of you. There's some goodies in the front pocket along with a thank you note. But anyways, again, another round of applause. Thank you so much.